Good afternoon, everyone. Welcome to the 4:30 press conference, March 30, 2020, here at the Commonwealth Healthcare Corporation CHCC Conference Room 3. Today we have the Honorable Ralph DeLeon Torres, Governor of the Commonwealth of the Islands, Esther L. Muñoz, Chief Executive Officer of the Commonwealth Healthcare Corporation, Warren Villagomez, the Chairman of the Governor's COVID-19 Task Force, and Dr. Conan, Medical Doctor here at the Commonwealth Healthcare Corporation.
Good afternoon. Governor Ralph DeLeon Torres, the Governor's COVID-19 Task Force, and the Commonwealth Healthcare Corporation has confirmed that one patient suspected of COVID-19 has passed away today, March 30th, 2020. Specimen has been sent out to Guam Public Health Lab, and we are awaiting the results of COVID-19 testing. Guam Public Health Lab has assured us of making this test a priority as soon as it is received. This patient was a 70-year-old elderly male CNMI resident. He was seen at CHCC on March 25th and was considered to be a person under investigation, a PUI. Based on this clinical determination, CHCC issued an order of quarantine for the patient and his wife to be cared for at Kanoa Hotel, the designated quarantine location. Unfortunately, he has an underlying multiple medical conditions. A treatment plan was offered, but next of kin opted for comfort care at the hotel, which was adequately provided. The deceased male had no travel history, but contact with someone who had tested positive for COVID-19. For most people, the coronavirus causes only mild or moderate symptoms, but for the elderly and the people with existing conditions, it came to cause more severe illness. The vast majority of those who are infected recover. As of today, March 30th, 2020, there are 2 confirmed COVID-19 cases in the CNMI. Now more than ever, we need to embrace these preventive methods such as social distancing, which are not a cultural norm. We can't stress enough how it is very important for everyone in our community to stay at home and leave only for quick trips to the grocery store or to pick up food. Thank you.
Good afternoon, everybody. Afide and Tiro Maranas. It is very unfortunate news, and we never want to make this type of announcement. Lieutenant Governor Palacios, our families, and I extend our deepest condolences to the patient's wife and family. We are deeply saddened by the passing of our community. Our thoughts are with the deceased family during this difficult time. We will render all necessary assistance to his family. I understand that the CNMI residents will be affected by this news. Let's make a moment to reflect, and may our thoughts and prayers in this difficult time for the family. We must take courage and continue to play our part to fight this virus. Since Saturday, we've been executing the next steps of our CNMI pandemic plan forward to protect the CNMI from the spread of the COVID-19. This job is never easy, and I thank the doctors, nurses, medical workers, first responders, and law enforcement for continuing to keep our community safe. I also want to thank their families for allowing our first responders and those that are helping on this issue and matter. I also want to thank our business partners, store owners, and workers for providing the necessities for our community. We will continue to work and do everything we can to be proactive as a government and implement strict social distancing procedures to keep you, your families, our manamko, and our loved ones with pre-existing illnesses. Again, I want to thank our CHCC Esther Muña, our task force chairman Warren Villagomez, all the doctors and nurses, and all the emergency staff here at CHCC for their dedication and hard work. Effective immediately, we will be enforcing our curfew. The new curfew includes everyone, not just minors, but at all ages. Starting tonight, 7 o'clock. I better read it down so I make sure that everyone is included. If you are not part of the exception, then you need to stay home. Starting tomorrow PM, the effective date is tonight. Starting tomorrow night, citations will be forthcoming for anybody that does not fall under the exceptions of curfew hours. Now, those that are exempted are law enforcement officers, first responders, private sector employees on duty during curfew hours. They will be the only persons allowed to leave their homes anytime after 7 p.m. and before 6 a.m. Violators will be cited according to law. And I also like to address our boat ramp and docks. Only Garapan Fishing Bay's boat ramp will be open for small boats only. Small boats will only be allowed to operate within the lagoon. No access beyond the reef. Reasoning, due to the escalation of COVID-19 situation in the CNMI, government resources are redirected to assist with COVID-19 response and operation. As a result, boating safety operation and response will be limited only within the lagoon. We do not have access or the capacity to respond to any emergency or distress calls beyond the lagoon. Hence the boat restriction. Once full capacity can be restored for boating safety, this restriction may be revised. All public beaches, parks, including pathways, will also be closed to the public. Now more than ever, please take these executive orders seriously. We are working on all the languages that we have to translate this, and that's why the effective and for citation will start tomorrow evening. Para ambos todos ni manen kungo. Este na informasyon ni nós ambos pogo ni guarda domingo. Por favor, pega este coração mizo. Na todo e mami guini para o CEO gispetar e COVID-19 Task Force e doktor, médico, polícia, enfermeiro, por hamzo ng tsetsegustige para protection mizo. Zangin manyoga hamzo gigima, mas bula chansa na familya mizo, tiyo tinilisti na virus. Lomuski ano, taja siguro na tiperin matlatin holong. Mutimos dangin sigi manhudsun kitsalan. Timalang kuzo na bebitogwis ti 7 p.m. curfew para todos. Diyan po mautsumitasi para hafan na park lo para minaulekta todo ugagago pinasensyan midzo continua tinazuzo diyan po favor maila za tatsogwi hafa devi para tatsogi gigima tafanyaga gigima tafagasi ka naita ni dinansi na manera usay abun 20 seconds ni abun dinansi dan talu kumugaha hafa na nisisidot za debi nun hono either tagu famagon mo or hogu personat Hano pretenda pat offer pes biro tatti gigima. Talo gili ni segundo na maglahi as Arnold Palacio se fet million mommy. Ugogogo bendición mizo, antinazuzut mizo. Zat cooperation mizo. Por favor, mala zata fanyaga gigima. Sin mas, buenos dias.
All right, thank you, Governor. At this time, we're going to open up to questions. One question, one follow-up. I'm going to go down the line really quick. We're going to start off with the CNMI media partners. We're going to start off here, here in conference room 3. We're going to start with the Mariners Variety. Lynn, your question and your follow-up. Lynn, go ahead.
Are the media
Can you come closer?
or the members of the media exempted in the curfew?
You're working? If you're working and then yes, you are.
And your follow-up, Lynn? You done? Okay. Saipan Tribune? Justine?
Especially for Canoa, regarding the air conditionings, is it like centralized? And if so, like how can you guys protect other people who don't have it?
So, before we chose Canoa as a quarantine site, the engineering, our engineer, part of the appointment of Governor Torres' task force, went into the mechanical room and determined that the air conditioning system does not recirculate, so it's a direct flow. So it is safe and sound to be the site for this quarantine site.
And after patients or like people who are quarantined in Canoa, after their 14-day term in the site, do they get tested or like do they get like retested
We-
or like?
We are working. CEO Munya is working hard to acquire testing capability, but what we do is continue on the monitoring, and of course they're already enrolled in the Text Illness Management System. We will continue the effort to monitor them as well after the 14 days.
If they've spent 14 days and have not had symptoms and they've had no new exposures, they're not going to get sick. They're well. They've made it. Now they need to go home and be very careful to not be exposed again.
Thank you,
Also,
Chairman.
I want to acknowledge there's a question or concern about dialysis patient. All dialysis patient, regardless what time you come in or what time you leave, you are exempted, and those providers where there's transportation or family members that would be taking you to your dialysis time frame. So all the exceptions for dialysis patients.
And may I add? Okay, so also to add, if you are on dialysis and you have an arrangement with St. Michael's, because of that effort and transportation, or St. Michael's Priority Care, I apologize, they are part of the essential group.
Thank you, Governor, Dr. Chairman. At this time, I'm going to give it over to Ashley McDowell at KSPN. Ashley, go ahead. Your question, your follow-up.
Okay. Can you guys hear me?
Yes.
Yes.
Hi guys. So I'm just wondering the number of tests, the exact number of tests that have been sent to Guam to this point.
We have sent about 20 specimen, and 11 are still pending.
And do we know when we might get the results on the 11?
As I mentioned earlier, the Guam Public Health Lab has assured us that they are going to make our testing a priority.
Thank you.
Also, I would like to expand a little bit on that. I do communicate with Governor Liu on a daily basis as well, and she's also assured me that, and she's offered also herself and the government to assist us, especially for the testing kid. So I know that even in Guam, there's very limited resources and the ability to test. But again, our request is being prioritized as well.
Is the rapid response test kits, is that going to be an option for us?
We're looking into it.
Thank you.
Okay.
Thank you.
Thank you, Ashley. We're going to go over to our partners in Guam. We're going to start off with KUAM, Thomas Pangolian. Go ahead, Thomas. Question and your follow-up.
If we feel for the family and express condolences, I wanted to start by first asking: Are the two confirmed cases that were announced over the weekend? Is it related to this case at all?
Yeah. Yes.
And so they are you able to share the relationship or to the extent of how this contact was made?
No, I cannot share that. What I can say is that there was contact, so that's the reason why we're testing them.
And follow-up question is for Dr. Conan. Doctor, what symptoms were presented that leads us to be labeled as a suspected case? And to the extent that you're able to share, what were the underlying conditions? And this is also a part of the question. Some jurisdictions are requiring burial within 24 hours. Is that the case here as well for the CNMI?
I can answer the first questions. I can't answer the burial question. There's lots of symptoms from the COVID virus, which makes it so difficult. It can mimic a lot of other things like flu. It can cause a fever, it can cause diarrhea, nausea and vomiting, cough, shortness of breath, respiratory symptoms. So that's part of the problem, is that it mimics so many other things. I can't tell you those underlying issues for this person who is now deceased, but I can tell you that it's a risk in people who are older, people who have problems like renal failure, diabetes, hypertension, heart disease. That's why we all need to be careful for ourselves so we don't carry it to those people as well. Even if we're healthy, it is our responsibility to take care of our neighbors and keep the services clean, don't spread it to them.
And for the second part of the question, I just want to say that we would like to allow the family to grieve. Please let them, let's give them some time, and then we will be meeting with them personally. Thank you.
If I could also ask another follow-up. In terms of the accommodations at Kanoa Resort, was initial care provided? Were any medical equipment brought into the facility for that care? And also related to Kanoa, how are quarantine travelers being separated from those who are isolated? I know there might be a difference.
We have a 24-hour.
Yeah, we're there all the time watching people. There is some medical care available. It's clearly not a hospital. Anyone who needs hospital level care would be here. Anyone who does not would be there. Quarantine people who might have a cold or things we are monitoring and keeping track of. Care was provided previously and will continue to be provided. There's medical staff there all the time. Was there the part of the question?
Separation of the floor.
Floors are separating people. We're being very careful to keep people on various floors, so they are separated that way.
Yes, thank you. Regarding the burial question, I was just asking that because I know other jurisdictions have strict rules regarding that, so thank you for clarifying.
Yep, you're welcome.
Thank you, Thomas. Before I leave KUAM, Sabrina, Jason, one last follow-up from KUAM.
Thanks, Kevin. Sabrina Mazzanoni from KUAM. I did want to follow up on the information that you guys relayed. You mentioned that the 70-year-old man was seen at the Commonwealth Health Center on the 25th. Can you hear me?
Yes.
Yes.
So he came on the 25th. And one of the COVID positive patients there also came in to the center on the 25th. Would the contact then have occurred at the CHC? And if that is the case, what are you guys doing there to minimize the exposure to people that are coming into the hospital?
We can absolutely confirm it did not happen at the hospital. We're taking all kinds of precautions. We aren't letting in a lot of visitors. We're doing social distancing. Staff is wearing masks. We've taken great care to keep the hospital safe. We had the tent out in front to keep anyone who has a question, who may have COVID, to be seen at a space outside, not coming into our hospital. We've taken great precautions for that.
Okay. And then my follow-up question then would be, then if it's not in the hospital, could it be through this faith-based organization that was mentioned during the press conference on Saturday night?
Well, I think at this point, we can't say, we don't want to mislead the information as to what could be or what could not be. I mean, we all know how COVID-19 is contagious and contaminated from one to another, so we just cannot make that assumption or
I would say also, we may be having community trans. Don't assume it was just in one place. Assume it's everywhere. Everyone needs to be careful. Everyone needs to stay home. Everyone needs to wash their hands. It was not just in one neighborhood. It is everywhere. Assume it's everywhere. A lot of people don't have symptoms. Even if you feel well, you need to wash your hands. Don't touch your face. Don't touch your mouth. Don't touch your nose. Wash common surfaces. Assume everyone has it. Assume that you have it. Protect other people who you are near, and make sure that they are protecting themselves as well.
Thank you.
Excellent. Thank you so much. We're gonna move on. We're gonna move forward from KYM. We're gonna go over to Nick Delgado. Nick.
Delgado with the Guam Daily Post. So, how are the two people who tested positive? How are they doing?
They're doing well. We're watching them closely. Things are good.
Right, and they're in isolation. And
Yes.
Yes, they are.
can you say at this point how many people that you all are testing that might have come in contact with these two positives? And are you guys doing any contact investigations already for the 70-year-old that passed away?
We have done contact investigation as soon as they walked in at our facility. We have done that. And we are doing some more testing tomorrow as well.
Can you say how many tests, how many people you're testing in relation to?
We're sending up right now, the count is 8.
That's in relation to the confirmed cases, correct?
What was that? I'm sorry?
That's in relation to the confirmed cases?
Not necessarily. Not necessarily.
Thank you.
You're welcome.
Okay, thank you, Nick. I know we had to limit folks on the initial Zoom link that went viral in the Marianas, apparently. I want to just see if we have PNC and MBJ on the line. I know I tried to send the link over to Maureen and PNC. Just wanted to double check if they're on the line. Nope. Okay. We'll just leave it at closing remarks for now, Governor.
Well, pero ano, just tell everybody, this is exactly what, again, we came here the other day, telling everybody how important it is to stay home. We get this information today. Unfortunately, we still have community members out there that does not take this seriously, and thus we're making a stricter need for one purpose and one purpose only, is for your protection. And we constantly change it to make it stricter for your protection. Not about convenience, it's about saving your life, the life that you love. Because I love her, and I take that same approach to everywhere else I go. Paramzo todos tatlo ni manay kung Hugagogo sosozu hamzo. Por favor, fanyaga gigima. Enigi na zangi nun sogwi nigi mas dongkulu chansotta para tagarnasti di COVID-19. Kada hundingi gima tumakilo ya oportunidad na parang sule halum este na virus halum gigima. Pues antes nung dingi gima mo hasufa ko worth pundingo sa punsile halum or malenyong saga. Sago ganyak ko sumaga Gautungan, pareho sa ni first responders, i-doktor, enfermera, kung todo siya man malago, manyakagigim niya. Lo kung todo siya, mananay animo para protehi interamente maranas. Para hamzo ni manggay familia, zaman matsotsotso, the first responder par offer na posisyon. Pugagago hamzo, nanay hamzo donklo na si Jesus masik, non se sedi, ya sagod midzo, kamagod midzo, na pugaygi di front line para protehi interamente maranas. Si Jesus masik and buenos dias.
Thank you, everyone. That concludes our press conference. Have a great day. I'll be available for follow-up with meetings.